Health and Safety Training, Making It Work. This course is designed to teach individuals about common health and safety practices. It covers common health hazards that are encountered in the workplace. These health hazards include exposure to chemicals, asbestos, silica, and lead. Topics include identification and evaluation of health hazards and their sources of exposure, health hazard information, and work practice controls. After completing this training and successfully passing the quiz, you will be able to understand common health hazards in the workplace and identify methods for controlling and minimizing workplace hazards. Workplace safety. The Workplace Safety and Health Act covers the health, safety, and welfare of persons at work in a workplace. It requires stakeholders to take reasonably practicable steps for the safety and health of the workers to minimize their exposure risks. OSHA is the federal agency which has the oversight for worker safety and health in the United States and territories. OSHA stands for the Occupational Safety and Health Administration, which is a part of the U.S. Department of Labor. OSHA is responsible for the endorsement and enforcement of standards to protect workers. OSHA serves as a means to promote workplace processes. OSHA duties include, but are not limited to, workplace inspection, setting standards, investigation, citations and penalties, education programs, and record keeping. All employees should follow OSHA standards. Safety is a best management practice that focuses on the minimization of risk while maximizing the quality of life. The target of health and safety is no injuries, no environmental accidents, no breaches of security at the workplace, no damage, no ill health as a result of hazards in the workplace, and accurate documentation when and if incidents occur. Hazard identification. Two examples of workplace hazards are safety hazards and health hazards. Defining hazards in the workplace. Health safety hazards are defined as, but are not limited to, exposure to dangerous conditions or substances such as chemicals, dust, gas, and/or noise, working conditions which result in illness or injury, and often not immediate between exposure and disease. To accomplish hazard identification, the organization should conduct tabletop exercises to help you plan and test your response plan and procedures, assess foreseeable emergency scenarios or non-routine tasks, evaluate each standard by considering the severity of potential outcomes, the likelihood that an event will occur, and the number of workers exposed, and prioritize hazards to the greatest risk are addressed first. Ways to accomplish workplace hazard identification. Get input from workers, safety consultants, or investigate other workplaces with similar hazards. Use interim control measures to protect employees until permanent solutions can be implemented. Establish target completion dates. Track progress. And verify implementation. Workplace safety hazards is defined as, but are not limited to, harm that results in some type of injury at work, injuries that result in cuts, bruises, broken bones, loss of limbs, and other, working condition where harm to workers are frequent and immediate and in a violent nature, and associated with dangerous machinery and poorly guarded equipment. A hazard is anything that may cause harm, for example, electricity, heavy machinery, and working from heights. How safety applies in the workplace. For an effective health and safety program, management and leadership should develop health and safety plans, establish realistic, measurable, and obtainable goals that demonstrate progress, define community responsibilities for accountability, and implement health and safety plan into risk management and budgeting. They also should commit to communicating health and safety programs, set examples for employees, communicate the health and safety policy to all workers, contractors, persons served, visitors, suppliers, and other stakeholders, and allow employees time to complete competency-based training. They must establish a process to report injuries, near misses, and other health and safety concerns, maintain an open-door policy inviting workers to speak to managers about safety and health, empower workers to temporarily suspend work that they feel unsafe, and establish protocol for reporting incidences. Every effective health and safety program should conduct site inspections, ensure employees from all levels of the organization participate regardless of education, health, or skill level, provide safety data sheets, analyze and review results of exposure monitoring, ensure policies and programs do not discourage participation of workers, and have experienced trainers. Your obligations as an employee include, but are not limited to, do not put yourself or a colleague at risk. Follow safety procedures your organization has implemented. Report hazards and incidences that occur in the workplace. Help your employers to improve workplace safety. Employers are required to create a hazardous chemical inventory, ensure each chemical has the GH style data sheet, make sure each chemical is labeled properly, create and implement an employee training program, and develop a written hazardous communication standard program. Employer obligations to employees include, but are not limited to, a safe work environment, procedures that help you work safely, training so you can do your job safely, supervision to tell you if any task comes with hazards, and protective equipment and clothing. The benefit of health and safety programs may include, but are not limited to, better morale, improved recruiting and retention, improvements in product, process, and service quality, and a more favorable image and reputation. A safety data sheet, material safety data sheet, or product safety data sheet is an important component of product stewardship and occupational safety and health and spill handling procedures. A flammable substance is any substance easily ignited and quick burning, including liquids with a flash point below 95 degrees Fahrenheit. A toxic substance, alone or via chemical reaction, is able to cause harm, produce injury to the body through absorption, indigestion, inhalation, or injection. A caustic substance is any substance able to burn, damage, or destroy organic tissue by chemical reaction. A hazardous chemical is any chemical which is classified as a physical hazard, health hazard, simple asphyxiant, combustible dust, pyrophoric gas, or hazard not otherwise classified. OSHA has developed a hazard communication standard to help protect employees from the dangers of hazardous chemicals. The Hazard Communication Standard is commonly known as HAZCOM, or the Right to Know Law. This regulation gives employees the right to know which chemicals are being used in your workplace, the possible dangers you could be exposed to, and how to protect yourself and others when using hazardous chemicals. OSHA considers a health hazard to be any chemical which is toxic, corrosive to the skin or eyes, a respiratory sensitizer, may cause cancer, birth defects, or reproductive issues, can attack specific organs, or harmful or deadly when inhaled. Physical hazards are chemicals that can cause fire, explosion, or a violent reaction. Material safety data sheets are provided by suppliers with all deliveries. They must be current, they must be made available to the attending physician in the event of exposure, and must be accessible to everyone in the workplace. SDSs are used to identify chemicals that are used in your workplace, possible dangers you could be exposed to, and how to protect yourself from others. When a chemical or product is no longer in use, the SDS is removed from the binder and thrown away. You share with the human resource manager that the SDS for chemicals no longer used. You must still keep safety data sheets, and they must be retained for at least 30 years. Recognizing the cost of workplace accidents. There are two types of cost: direct cost and indirect cost. Direct cost of workplace accidents include, but are not limited to, cost of treatment, cost of physician and hospital, cost of medical equipment, and cost of medications. The indirect cost of workplace accidents include, but are not limited to, retraining, schedule delays, increased absenteeism, lower morale, and poor customer relations. It is important to identify potential hazards for the following reasons. 1. They make assessment for the likelihood of hazard causing injuries, illness, or damage to health, and they review potential impact of a hazard on employer. Companies that have effective safety committees have an increased awareness of safety challenges and are able to be proactive in their reactions to health and safety related issues. It is important to evaluate the results of hazardous incidents for the following reasons. An evaluation can help determine the effectiveness of the change made to fix the problem. An evaluation can gain employee insight. An evaluation can determine if solutions to risk were acceptable. An evaluation can assess if solution created new hazards or increased the risk of existing ones. Report writing. A report should be written for every hazardous incident. A written report must include what, the description of the event, when, the time and date of incident, where, the location of the incident, who, person, witness, and reporter, and why the incident caused and corrective action to prevent reoccurrence. The Commission on Accreditation for Rehabilitation Facilities required that facilities complete 6 emergency drills annually. Fire drills, tornado drills, medical emergency drills, violent and other threatening behavior drills, bomb threat drill, and a utility failure drill.